Hello, my name is Jack Pfeiffer, and I'm here to educate you on the genetic basis behind the infamous disease called cancer. Cancer is a very complex disease, and as of a few decades ago, humans did not know much about it. However, over the last few decades, scientists have made great advances in the knowledge base about what causes cancer and how we can treat it and prevent it. Statistics estimate that about 40% of people will develop cancer at some point in their lives. 3 years ago, when I was 16, I became one of them. I was diagnosed with Hodgkin's lymphoma. After a few months of chemotherapy, my cancer was treated and I have been healthy since. So, if you or a loved one has been diagnosed with this notorious disease, do not panic. Currently, about 70% of cancer patients are still alive 5 years after their diagnosis, and many are cancer-free. Of course, this rate is much higher among young patients. In case you or someone you know has been diagnosed and have questions about what cancer is and how you or your loved one became affected by it, I'm here to provide some background information about the scientific and especially the genetic basis behind cancer. Cancer is defined by the presence of a malignant tumor. A tumor is an abnormal growth of cells that divide and grow uncontrollably. Tumors can be either malignant, meaning that they are rapidly growing or spreading to other parts of the body, or they can be benign, in other words non-cancerous. Cancerous tumors are so rapidly dividing that they require a lot of blood supply for oxygen and nutrients. Because of this, cancerous tumors recruit additional blood vessels to bring in larger quantities of these nutrients. Doctors use this knowledge to their advantage when diagnosing cancer. A patient will receive an injection of a form of glucose which can be detected in large quantities by a PET scan. The glucose-like molecule will be gathered at the sites of tumors and the PET scan lights up at these sites. There are many different types of cancer, and each type is defined by its tissue of origin. This means that, for example, cancerous lung tissue can be found in the liver and will still be called lung cancer. Cancer can occur in just about any tissue of the body. Lymphoma affects lymphocytes, which are a type of white blood cell important for fighting infection. The diversity of cancer types also creates diversity in how the disease presents itself. My predominant symptoms, despite the disease occurring in tumors found in my lungs, were intensely sharp pain in my lower back, night sweats, and a rash that appeared on my inner thighs. This all shows how incredibly complex cancer is, and it is this complexity of the disease which makes it so hard to find a cure. Cancer is viewed as a genetic disease, meaning that it results from genetic mutation. People often misinterpret the genetic basis of cancer to mean that the disease is directly hereditary. The reality is that most types of cancer, while possibly related to an inherited susceptibility to disease, are not themselves hereditary. However, there are a few genes that have been discovered to be hereditary in that inherited mutations greatly increase the risk of developing cancer. One specific example is the gene BRCA1, which codes for a protein that suppresses tumor growth in breast cells. Women who inherit a mutation in either BRCA1 or BRCA2 have about an 80% chance of developing cancer, breast cancer more specifically, at some point in their lives. Despite a few exceptions, however, cancer is not typically an inherited disease. So, if someone in your family has been diagnosed, do not worry about having an increased probability of developing cancer yourself until you do some more research on your family member's specific type of disease. Regardless of whether an occurrence of cancer has a heritability component, cancer is always caused by a genetic mutation. Mutations are changes in DNA sequence in our cells that result in changes in proteins expressed by our cells. This causes a difference in the processes that our cells undergo. Mutations happen naturally throughout our lives, but they can cause cancer when specific types of very important genes are altered. Genes that can mutate to cause cancer include genes which regulate telomerase, genes helping with DNA repair, and genes which control the cell cycle. Telomerase is a protein that adds unexpressed regions of DNA, called telomeres, to the ends of chromosomes. In normal cells, chromosomes shorten over time and eventually start to infringe upon the coding regions of DNA. When this happens, the cell initiates apoptosis, or programmed cell death. If a DNA mutation occurs in genes that regulate telomerase, it will continue to add telomeres to the chromosomes, creating an immortal cell. When a cell becomes immortal, it can keep dividing uncontrollably into new cells and form a tumor. Genes that help with DNA repair are also important in preventing cancer. These genes help correct mutations that arise in a cell. When a DNA repair gene is mutated, further mutations in the cell quickly pile up. More mutations mean that there is an increased chance that a mutation will cause a tumor. Mutations can also cause a cell to move more quickly through the cell cycle, and rapid DNA replication is more prone to error. Tumors often develop from this cumulative effect of mutations. The cell cycle is a major factor in cancer development. The cell cycle is the process by which a cell replicates all of its DNA during the S phase and divides into two daughter cells through mitosis. In healthy cells, the cell only moves through mitotic divisions when appropriate, and can sometimes remain dormant in what is called the G0 phase of the cell cycle. However, cells with mutations in genes that control the cell cycle will divide rapidly at inappropriate times and will therefore create tumors. It is this characteristic of cancer that makes chemotherapy an effective treatment for cancer. Chemotherapy is the administration of chemicals that target the most rapidly dividing cells in the body, so that cancer cells are killed. Hair cells are some of the most rapidly dividing in the body also, and this is why chemotherapy causes a patient's hair to fall out. There are two specific types of cell cycle regulating genes that are especially significant in the development of cancer. These are called proto-oncogenes and tumor suppressor genes. Proto-oncogenes are genes that serve a variety of functions, including stimulation of cell division. Proto-oncogenes can be mutated or overexpressed to form oncogenes, which inhibit the regulation of cell division, and therefore induce cancer. Because an oncogene expresses a protein that causes cancer, it only takes a mutation of the proto-oncogene in one of our two chromosomes to induce tumor growth. This is called the one-hit rule. Tumor suppressor genes code for proteins that function as cell cycle regulators, making sure that the cell division is appropriate before allowing the cell to move through the cell cycle. When tumor suppressor genes are mutated, the cell cycle is no longer properly regulated and the cell can divide uncontrollably, which of course creates a tumor. Unlike oncogenes, tumor suppressor genes follow the two-hit rule. In other words, because the tumor suppressor gene codes for a protein that prevents cancer, both copies of this gene must be mutated in order for cancer to develop. By now you know that cancer is a very complex disease resulting from uninhibited cell division. Mutations occur normally in all humans, and we have many defense mechanisms against cancer, so it typically takes a great accumulation of mutations to induce tumor growth. This is why we need to reduce the amount of mutations that our bodies undergo. We can do this by reducing our exposure to mutagens, which are factors that cause an increase in the rate of DNA mutation. Mutagens include asbestos, cigarette smoke, and ultraviolet radiation. By reducing exposure to these and other mutagens, we reduce the probability of developing cancer. If you or someone you know has already been diagnosed, know that there has never in history been a time with as high a survival rate for cancer as there is today. For many cancer patients, depending on patient age, cancer type, and cancer stage, survival is not only predicted but expected. 3 years ago, even after telling me that I had stage 4 Hodgkin's disease, the doctors always expected me to be healed. Today, 3 years later, scientists and doctors have that much more knowledge about how cancer can be treated. As complex as the disease is, every day we get one step closer to finding a cure for cancer.